Hello, my name's Fernando. I'm going to be your nurse today. We're going to be doing some suctioning and trach care. Can I go ahead and verify your name and date of birth? If I could just have you nod your head that your name and date of birth is John Doe XXXXXX. All right, great. All right. I'm going to go ahead and position the bed to a comfortable position. Use it a little. Hand hygiene. All right, I'm gonna go ahead and listen to your lungs, Mr. Doe. I'm gonna uncover you. All right. Looks like you sound a little congested there, Mr. Doe. If I could just have you take a few coughs to get some of those secretions going. All right. Thank you for taking those coughs. So I'm gonna go ahead and hyperoxygenate my patient. I'm gonna turn on the suction to a continuous setting. All right. And then I'm gonna go ahead and get my kit ready. For solution. So I'm going to go ahead and don my sterile glove by using my non-dominant hand to glove my dominant hand. Don the other glove. Okay. Go ahead and grab my cannula, wrap it around my Okay. Then I'm going to go ahead and remove the oxygen source. So connect the cannula. Alright. So now I'm going to go ahead and test the suctioning. Alright, suctioning works. I'm going to recoil it. Alright, so I'm going to go ahead and remove his oxygen source. Alright, Mr. Doe, we're going to go ahead and start suctioning. So I'm going to go ahead and insert the cannula 6 inches. Once you feel resistance, and then once I feel resistance, I'm going to start suctioning, pulling it out. Circles, less than 10 to 15 seconds. Okay. And then we're going to put the oxygen source back on. I'm going to go ahead and assess for signs of hypoxemia. Assess their O2 stats and their pulse rate. All right, I'm going to listen to your lungs, Mr. Doe. All right, looks like you sound a lot clearer, Mr. Doe. So we're gonna go ahead and discontinue the suctioning. So I'm gonna go ahead and disconnect it. There's no need to clean it. So I'm gonna go ahead and disconnect the suctioning. Turn off the suctioning. All right, and I'm gonna go ahead and remain sterile with my one glove. Okay. Go ahead and grab everything. Separate what I'll need. All right. And so now I'm going to go ahead and remove the oxygen source. Remove the cannula without touching the inner part of the cannula. Put it in the solution. Okay, so now I'm going to grab and clean the cannula. Put it back in the solution. Dry it. I'm going to go ahead and put the cannula back into the patient without touching the inner part of the cannula. Put their oxygen source back on. At this point, I'm not sterile. I would grab a new cleaning kit for Q-tips because this one's out of the sterile. It's half of it's touching it. So I would use my clean one, clean the stoma, and you're assessing the stoma for signs of redness and assessing the stoma skin. To clean the top, remove the old dressing. Then I would have a new clean, remove, clean. So then I can now dry it. So I would dry the stoma. Dry the top part. Then we would put the dressing back on. Dressing back on. Then we would put on the new straps while leaving the old straps on. Alright, Mr. Doe, just grabbing these new straps to put them on you. Okay, make sure it's on there tight. Alright, Mr. Doe, if I could just have you lift your head up a little bit. Thank you. So I'm just going to reach over you, Mr. Doe. Make sure it's on tight. And then we can remove the old one, which is the bottom one. On this side, it's the top one. Okay. Alright, I'm just going to pull that out behind you, Mr. Alright, make sure the other one stays on. And trash that. Go ahead and move my stuff to the side. Put his oxygen back on. I'm going to go ahead and reassess you. I'm going to listen to your lungs. And while checking for signs of hypoxemia, also checking their O2 stats and their pulse rate. And then I would document the procedure and document that there was no redness in the stoma and get rid of all my supplies. And lower the bed to a safe position. And turn off our continuous setting on suction and put the patient back on normal oxygen. All right, and make sure they have their call light. All right, and go ahead and do hand hygiene after the procedure. All right, and and then I would document the procedure. Patient tolerated the procedure well, and their lungs sound a lot clearer after suctioning.